So we talked about the inflammation phase or acute phase, the proliferation phase or the subacute phase, and now we're going to talk about the maturation phase, which is the return to function or the chronic phase. That is where our scar tissue is maturing. So the maturation phase is the longest phase, and it can persist more than a year after injury. The ideal outcome is restoration of the injured tissue to its prior function. Of course, scar tissue is not going to be as functional, but if the smaller the wound, the smaller the scar is going to be and the more functional tissue you're going to have, and the more tissue replacement. During the maturation phase, there needs to be a balanced synthesis and lysis of collagen. That's required for normal remodeling of the scar. So as you are moving and having therapy and doing different things during the maturation phase, and we often don't see people all the way through the maturation phase. We might see them later on in the maturation phase, either for something else or they came back because they have issues with their scar. So when we're going into the maturation phase, we are trying to get the normal remodeling. If there is too much synthesis and not enough lysis of collagen, you can get keloid or hypertrophic scar results. High oxygen exposure favors hypertrophy of scars. Macrophages are more efficient when they are in a high oxygen environment. So oxygen, however, is important for healing. So you need to have, it's a balance, just like so many things in our body with homeostasis, where it's a balance between not too much of one thing, not too much of the other. So it's exactly the same thing with normal remodeling of scars. So as the scar is remodeling, type 3 collagen is replaced by type 1 collagen, which is stronger. And it gives you a nice firm scar that's going to hold you together, basically. And what we really want to encourage with manual therapy and with exercise is we want to have a flexible scar that's not stuck down and it's not stuck to other tissues. So with scar mobilization or scar massage, we can help lay down a more functional scar with active movement that the patient does. That also helps lay down a more functional scar. So this is a way that we can sort of nudge people in the right direction. People who are really good scar formers, sometimes they have issues with adhesions, and they have to have manipulation under anesthesia after a surgery to break those adhesions. Or sometimes they have to have second surgeries to remove some of the scar tissue. So we would like to avoid that. And I always say what we do in physical therapy is sort of nudge people in the right direction. So we want to nudge them towards functional scar formation with the treatments that we do. So with chronic inflammation, in general, acute is no more than 2 weeks. Once you're past 2 weeks, you're out of the acute phase and into the subacute, which is more than 4 weeks. And chronic can last for months or years. So people can have chronic inflammation from the persistence of an injuring agent, like cumulative trauma. If they have something that is continually causing a problem, like carpal tunnel syndrome is a really good example of this. If you don't stop doing the thing, or if your body doesn't stop doing the thing that caused the injury in the first place, you can develop chronic inflammation. And chronic inflammation interferes with the normal healing process. So chronic inflammation can increase scarring and adhesions. It can reduce the strength and the functional mobility of the tissue. So we'd like to address inflammation early on and address healing early on so it doesn't become chronic. So that's what a lot of what we're trying to do with our toolkit in physical therapy is we're trying to help people move through the stages and have a good outcome. So that's pretty important. So there are a lot of factors that can affect the healing process. There are local factors and there are systemic factors. So the local factors include the type, size, and location of the injury. So let's just say if you had a, we'll just say it's a laceration on your upper arm, you can probably immobilize that pretty well. It's not on a joint, and maybe it's a decent size, so that'll probably heal pretty well. If you had that same laceration on your elbow, you might be disturbing the tissue all the time by moving, doing normal movements, and that's going to affect the healing of that tissue. If you have an infection accounts for 50% of the complications of wound healing. So that's one of the things we're always looking for when we're dealing with people that are in the post-surgical stage, is we're making sure that the wound is not infected. The vascular supply in the area or in the particular tissue can affect the healing as well. So less vascular supply, less healing, more vascular supply, more healing. So I always say to people in the clinic, circulation equals healing. That's why we want you to exercise, because we want to increase the circulation. Some of the physical agents that we do also increase circulation, and we'll talk about it when we talk about each physical agent. So external forces can be therapeutic use of physical agents like cryotherapy, cold, thermotherapy, heat, therapeutic ultrasound, electromagnetic radiation, light, like laser light, electrical currents, and mechanical pressure. All of those have been used in attempts to modify the healing process. Too much early movement may delay healing. That's kind of what I was talking about with if you have a laceration on a joint, and every time you move, you break it open. So there's going to be some early immobilization or less movement. Systemic factors include age. Of course, children have more rapid and robust healing than the elderly. If you have ongoing disease like diabetes, immune, or vascular system diseases, those can all impair healing. Medications that have systemic effects like steroid anti-inflammatories, steroidal anti-inflammatories, they can decrease healing. So of course you don't want to be on them for very long. Your nutrition can influence healing because it fuels your inflammation and repair cycle. So a lot of times after surgery, people maybe they're on pain medications, they don't really feel like eating, but you want to encourage them to eat, because that's their fuel for inflammation and repair. When I was doing my clinical assignments when I was in school, I had one clinical assignment at Swedish Hospital in Seattle, and they actually had I was working on I worked different places in the hospital, but when I was working on the orthopedics floor, you'd go into somebody's room, they're post-surgical, maybe they had a knee replacement or something, and they had a nice system there. Each patient had a menu, and everything on their menu they could eat. So it took into account any dietary restrictions or any other things, and they could just order anything off the menu anytime they wanted. So I would go in their room and say, hey, how are you doing? Have you had anything to eat today? And they go, oh, not really very hungry. And then how about a smoothie? And let me call down to the kitchen for you and get them to make you a smoothie. That'll be easy to eat because you need fuel to heal. When we're working in outpatient, we can talk to our patients about eating to support their healing, even though that's not really necessarily what we normally do, but you can just encourage that they eat before they come in. With our joint gym program in the clinic where I work, which is a group exercise and therapy program for people after their hip or knee replacements, at the initial evaluation, the PTs tell them, make sure you have a little something to eat before you come in so you don't feel lightheaded or dizzy during the session. So we definitely want to fuel our repair. So with children, a lot of times if children have an injury, like they break their leg or they have a muscle strain or something, they usually don't need physical therapy because they heal fast and they recover quickly. Older people definitely might need therapy. Usually children only need therapy if they have like something huge, like they were in a car accident and have a lot of injuries, or they were in a fire, or they have some kind of systemic illness that is affecting them. So usually only kids with something else going on need physical therapy to heal. Otherwise, they just heal great. So this is a little review of the healing by primary and secondary intention. So primary intention, the wound is closely approximated. It might have sutures. The epithelialization goes faster because of that close approximation. And the angiogenesis of new blood vessels goes faster as well. Healing by secondary intention, you might have a rougher wound or one that's the edges aren't closely approximated, so it takes longer. And you might get different type of scar formation. So in the next section, we're going to talk about healing of specific skeletal tissues, musculoskeletal tissues.